Hello, and welcome to Community Pulse, a CAN TV program featuring local leaders and organizations focused on improving health and well-being in the city of Chicago. Community Pulse is presented by the Foxglove Alliance, a public healthcare coalition supported by the Hectone Institute of Medicine in partnership with the Healthcare Council of Chicago, HC3, which is managed by Third Horizon Strategies, and Hectone's Nurses and the Humanities. My name is Meghan Phillip, and I serve as the Executive Director of HC3, the Healthcare Council of Chicago. Today, our featured guest is Wren O'kelley from Howard Brown Health. Thank you so much for joining me.
Yeah, thank you so much for having me. I'm so thrilled to be here.
It's great. I asked Wren to join me today, not only because you are doing some tremendous work at Howard Brown year-round, but to provide access to quality healthcare that's affordable and meets the needs of our Chicago's LGBTQ community. But throughout the month of June, we are also celebrating Pride here in Chicago. So for our audience of Chicagoans that are tuning in that may not be familiar with Howard Brown, can you share a little bit of background on Howard Brown's mission and what you do for Chicago's communities?
Yeah, so Howard Brown, our biggest mission is for the LGBTQ plus community and many other communities to be a source of affirming care and to help act as an agent of social change to not just improve our communities, but improve life for individual people in the city and make sure everyone, can live their life to the fullest
That's great. So how does Howard Brown Health Center ensure that healthcare services are supportive and inclusive of our LGBTQ community in Chicago? And how are you addressing any barriers to these individuals that may be facing access to healthcare issues, or what steps are being taken to provide a welcoming and safe environment?
So I think what the first step is with that, honestly, is making sure that we're not just working for the community, but we make sure that our providers and our staff are part of the communities that we serve as well. So whether that's part of the LGBTQ plus community or in different neighborhoods in the city, making sure that the people that we're serving have an important voice in how we go about, structuring our services and doing outreach and recognizing what barriers to care exist. So for us, I think we're a little bit different than a lot of places in that we have a lot of intentionality around how we do the care and constantly improving that, and using things like patient feedback and new research and political changes to inform how we train our providers, how we train our front desk staff at our clinics, how we train everyone who works and is involved with patients, so that we can always be on the cutting edge of how we can be more respectful, more considerate, and recognize the barriers that people may be facing.
Yeah. So mental health related visits to emergency rooms by children and teenagers and young adults soared from 2011 to 2020. According to a report published in JAMA, the sharpest increase was for suicide related visits, which rose fivefold. The Trevor Project, a national LGBTQ youth suicide prevention group, also published a report indicating that close to a third of LGBTQ youth say laws and policies that target LGBTQ people have had a substantial and negative impact on their mental health over the past year. So nearly 1 in 3 LGBTQ young people said that their mental health is poor either most of the time or always because of policies and legislation that take aim at their sexual orientation or gender identity. So that's a lot. So I'm going to unpack it. So how is Howard Brown stepping up to support our youth? What types of programs or initiatives do you have in place to address the mental and physical well-being of your youth? And let's just go from there, and I'll add some more questions as we go.
Yeah, so recognizing the unique position that particularly LGBTQ plus youth are in, we've long operated something called the Broadway Youth Center, which is a center that focuses specifically on youth, not just minors, but I believe from age 16 to 24. And that is meant to recognize that people, and especially young people, aren't just dealing with behavioral health problems and physical health problems, that particularly for vulnerable young people, it's everything, really. And so the Broadway Youth Center is a space that can be drop-in or appointment, that we do everything from health services and physicals to providing therapy and social resources to helping people like with education and like access to other organizations that can help with things like housing, so that we have a space that's dedicated and thinks specifically about how young people have to deal with that. And we've been doing that for a while, but I think especially in light of what's been happening recently with legislation across the country, we've been trying to do a better job of making sure that not only we offer those services and have outreach to communities and young people, but to specifically make sure that the way we do that is especially safe and affirming, and we have good, like, basically like security infrastructure around it, so that we can make sure that the people who come in and get our services feel safe and feel comfortable, not just with whether their providers are affirming, but also like literally feel safe, you know?
Yeah, absolutely. And that's such a critical piece, is that trust that you've built with your communities, and really creating that safety net for them so that they feel comfortable going to a place. And clearly the center does that. So Howard Brown does have many locations, but there's a new one in the works for this fall?
Yeah, so we're really excited. We're opening a new Halstead location, essentially between our existing Halstead location and our Sheridan location, which are in Uptown and Lakeview, respectively. We're kind of maxed out on who we can serve, and we don't like to be working like that. We always want to be able to bring more people into our care, into our clinics. So we're building what's our new flagship location, essentially. It's something we've never done in this way before, but it's going to be a whole 5-story building where people can come and get everything from like maintenance labs to primary care, but we're also establishing our dental presence on the north side. Right now, we have a whole dental clinic at 63rd Street, but we don't have anything in the north side. So we're really, really excited to bring affordable, accessible dental care to the north side as well. And we're just super excited about it.
Yeah, I mean, that's really exciting. I mean, dental is one of the most underrated and most hardest things to support. I work with lots of FQHCs like Howard Brown and free clinics in Illinois and in Chicago. And I can say that adding that service line is going to be critical. And I feel like there will be a wait list the first day you open. So wondering what other types of, services, I think we talked a little bit about different programming, especially around youth, but are there any other types of things that we can know about and think about? Because often people don't necessarily think of healthcare clinics as a resource for other things. So, we talked about mental health, dental, primary care, but what are the other types of things that you're specifically targeting to our LGBTQ community, and especially around reproductive health and gender affirming care and other things that you guys are doing to support them?
Yeah, so I think oftentimes when people think of Howard Brown Health, they think of reproductive health, of STI screening, that kind of thing. And we've been trying to talk more because everything short of a surgery we can help you with, basically.
Yeah.
So we do everything from youth services all the way up to aging services and geriatric medicine. So whether you're looking for like gender affirming care, or you're looking for a physical for your school or work, or if you're looking for care for diabetes, all the way to if you're looking for help with what you think might be an STI, or access to services for like cancer screenings. All of that stuff we do, and I think people don't really think of that when they think of Howard Brown.
Yeah, no, that's absolutely correct. And I think that to know that there's wraparound support. So when you are going to Howard Brown, you can not only just get those screenings, but you can also get everything else that you need. It's like, when you go to the grocery store, you want to load up your cart. So you got lots of options. And what's nice is I think there's a lot of coordination amongst your providers to be able to offer that wraparound support, correct?
Yeah, of course. That's something that I think we have a lot of unique value in. Is I know personally there's so much value in the fact that my primary care physician talks with my specialists, talks with, you can be getting trans health services, and your provider for that might be the same person or talking to the person helping you with high blood pressure, And because at the end of the day, you're a whole person and you deserve whole person health care in your neighborhood, on your block, that understands you and the entirety of you, not just all these little pieces of you.
Yeah, and I think that's so critical in this time that we think about the whole person. I think so often mental health is looped into a whole other bucket, just because even the way that we pay for mental health services is different than our health services, as well as our dental services. So it's really great to see and hear how Howard Brown is approaching that and really taking whole person care to heart to a community that really truly needs it. I'm wondering also, where do you our youth are also very digitally inclined. If there's any resources or ways that Howard Brown is thinking differently in what that access point looks like, or if it's just the physical space, which is wonderful, but how are you expanding what safe space looks like?
Yeah, so we've been taking a lot of steps, especially in light of COVID and other developments, to make sure that we have more and more of our care available through telehealth, because we recognize it's not just like an illness problem, but an access problem. To get to a physical appointment, you have to be able to get transportation to go to a clinic, which may not be in your part of a city, or you may have work and it may be hard. You don't have the hour to get to where you're trying to go. So in all of our services, we're trying to have a better eye towards providing those in a variety of ways so that we can meet our patients where they are and make it as easy as possible for them to access these services.
Yeah. So whether it's youth bullied at school or online because of their actual or perceived sexuality, or even our elder LGBTQ potentially going back into the closet because of unwelcoming senior centers, the lifelong health of these groups is it's a matter of public health as a point of interest. Equitable healthcare for all, especially our LGBTQ people, can improve physical and mental health and help extend the average life expectancy of these folks. So what steps would you say Howard Brown is taking to provide patient advocacy and supportive services to offer to your communities that you serve, and helping them navigate the system and overcome some of those obstacles? I think we just talked about some of the digital access points, but I wonder from the advocacy and really honing in on how we break down these barriers in what that access and entry and advocacy looks like.
Yeah, so within Howard Brown, we have teams dedicated specifically to patient access and advocacy, because as a federally qualified health center, we serve patients regardless of whether they're insured or underinsured or what have you. But for a lot of people, particularly like immigrant populations, young people, unhoused or unemployed people, it can be really hard to get things like insurance or access to social services that make it possible to get the care and the respect and the resources they need. So we have teams whose whole purpose is to connect people with insurance, to connect people with other social service organizations, so that they can better access that stuff. And part of that is always growing what our relationships look like in the city, in the county, in the area, so that we can best recognize where that need is, what help is needed, and adjust our services accordingly, and then have the connections to make that work well in coordination with other organizations too.
Yeah. I mean, Howard Brown has been around since the 70s. So you operate in multiple clinics across the city of Chicago, serving thousands of patients annually. So how is Howard Brown engaging broadly in the LGBTQ plus community and promoting, health and wellness and fostering that sense of community support?
So in all of the neighborhoods we're located in, we have 10 locations across the city, everywhere from Rogers Park to Inglewood. And especially as we've grown into more parts of the city outside of where we were for a long time, which is like the Lakeview area, we've had a lot of attention to building relationships with local organizations and local politicians, older people, wide variety of stuff, so that we can make sure that we maintain those connections. Like I said, to be better responsive to what the unique needs are of the LGBTQ plus community, but also other communities in the neighborhoods and the parts of the city that we serve.
Yeah, that's great. I mean, really trying to be culturally competent to the fact that, there are other neighborhoods across. I mean, there are 77, now 78 neighborhoods in the city of Chicago, and it's really great to know that you guys are in 10 different places, so there's lots of access points, but there's still many other ways that we can think about where we can enter and be supportive in those communities. So as we wrap up, I want to think about any of our viewers that may be interested in Howard Brown's services and how they can access them.
Yeah, so I'd say there are 3 basic ways. One is walk into one of our clinics. We're in Rogers Park, Lakeview, Back of the Woods, Humboldt Park, Inglewood, Hyde Park, and North Allsted as well. And walk into one of our clinics, talk to one of our patient service representatives, and we can get you connected with care. You can also call us at 773-388-1600. Or we're really excited about this. We've just launched online scheduling so that regardless of whether you're a patient with us already or not, you can schedule all kinds of medical appointments online on our website at howardbrown.org. Right there on the front of the page is a schedule an appointment button. So whatever those works for you.
Yeah, make it easy. Press the button. And for folks out there that want to support, this is Pride Month and happy Pride. So what can viewers do to support that?
Yeah, again, go to our website. We have a whole section on how you can get involved with volunteering or donations or coming to work with us or anything like that. I believe that's howardbrown.org/volunteer and howardbrown.org/donate.
Great. That's all the time we have for today, but I want to thank you for your tremendous work, and to all of those at Howard Brown, thank you so much, and happy Pride. I also want to thank CAN TV's nonprofit services team for supporting today's production. My name is Meghan Phillip. Thank you so much for watching Community Pulse, which airs on CAN TV Channel 21 and is also available streaming at cantv.org. Stay well, Chicago. We will see you next time.